FDA panel's vote on peptides raises concerns about a prescribing boom. A Food and Drug Administration advisory panel recently voted to recommend broader use of 6 unproven peptides, directing the agency to add these substances to the list of items that specialized compounding pharmacies can prepare for patients. The panel endorsed 4 peptides on Thursday and 2 more on Friday, while also voting down the broader use of one rarely used peptide. Compounding pharmacies, which traditionally make customized medications for exceptional cases, have expanded into a multi-billion-dollar business that has largely been focused on copycat GLP-1 drugs. The panel's decision would shift peptide prescribing into the slightly regulated market, overseen mainly by state pharmacy boards rather than the federal approval process. During the meetings, FDA scientists expressed concern that none of the peptides under review have been proven safe or effective through rigorous clinical testing. They warned that any adverse effects could be difficult to detect because the recommended pathway would move peptide use into a market with limited federal oversight. The scientists noted that tracking hazards would be challenging, given the fragmented state-level regulation of compounding pharmacies. The panel's votes are likely to be welcomed by Health Secretary Robert F. Kennedy Jr., who has publicly advocated for broader access to peptides and has personally used some of them. In an unusual move, his office appointed 8 new members to the advisory committee that met this week, 6 of whom market peptides using promotional language such as revolutionary or claiming they can enhance disease resistance. This composition has raised questions about potential conflicts of interest. Peptides are short chains of amino acids that can signal cells to perform specific functions, such as reducing inflammation or stimulating collagen production. Some peptides, like insulin and GLP-1 receptor agonists, have completed the full FDA approval process and are available as prescription drugs. The peptides under discussion, including BPC-157 and MOSI, have not undergone that review. Despite lacking regulatory clearance, they have gained popularity on social media platforms, where influencers unbox the substances and claim benefits for skin tone, muscle recovery, or general wellness. Some videos refer to the peptides as peppers to evade content moderation rules. Beyond influencer circles, consumers who feel dissatisfied with conventional medicine or who distrust the pharmaceutical industry are purchasing peptides from longevity clinics, alternative health providers, and even TikTok shops. The panel's endorsement could further expand this market, although the agency's scientists caution that the lack of safety data poses real risks to patients. Any hazards that emerge could be hard to track, the federal scientists said this week, since the advised action would push peptide use into a lightly regulated market largely overseen by state pharmacy boards. The peptides under review had not been proven to be safe or effective, and could present risks to patients. The panel's endorsement could further expand this market, although the agency's scientists caution that the lack of safety data poses real risks to patients. Thanks for listening.